Okay, so now we'll get into how does this apply to me. I am a doctor, I am a hospital owner, I am a lab owner, I am a hospital manager. How does it apply to me? How many of you feel that AI can actually help us as doctors or hospital managers? 1, 2, 3, 4, 5, 6, 7, 8. Okay. So, I mean, I wish I'd asked this earlier, probably. Then I would have had a delta to see whether my talk was effective. But great. So a lot of us feel that yes, we can use it. It will be helpful to us. Let's look at what is possible. What is possible? Now, I want to go, before I get into this, I want to understand from doctors and people here, what are the problems that we are facing currently? So what are the solutions that you are looking for? Forget about robotics and 5G surgery. Forget it. It's not our cup of tea. I can tell the audience here, and I can tell you that you guys are not going to use it. Maybe Senthil might use it someday. I don't know. But most of us are not going to use it, right? So please tell me, what is your problem today in healthcare? What is it that you want to get solved today? What are the top 2, 3 things that come to your mind? Sorry, sir?
Medication errors.
Medication errors. You are a doctor or a hospital manager? Both. So you are looking at in your and do you work for private sector or government? Private sector. So as a private sector doctor, do you think medication errors is a top priority for you today? Just asking. All right. In your case, it is. Prognosis. Okay. So you want to define whether what will be the prognosis of a patient. Very good. Talk from a patient's perspective. Anybody else?
As an eye surgeon, I would like to have a view of the cornea or the retina and put it into that machine, and if it comes out with any specific answer besides what I'm thinking.
So you wanted to support you in diagnosis.
Yes.
Right. Fantastic. Right. You want medication errors to be corrected. Yes, ma'am.
You want screening, especially the genetic burden on the population.
You want screening.
Yeah.
Fantastic. Anybody else?
Coverage to the waiting in the queue of population.
Oh, you want access to doctors, right? Say, or access to healthcare.
Access to patient.
Yeah, access to healthcare. So as a patient, I would like to access a doctor. It's a problem of accessing, right? Okay. Waiting time. All right. Guys.
Billing section.
Huh?
Most dissatisfied area is billing section.
I want transparency in billing, right? What else?
Come across people with low back pain.
Low back pain. I'm having one.
It is a symptom,
Right.
not a diagnosis.
Absolutely.
And we look at the list of causes, there are more than 100.
Yes.
Can AI help us in making an accurate diagnosis based upon some inputs from the investigation, some information from the history, like that?
So he's talking about diagnosis again. So I would like to help. I would like help in diagnosis, right? What else?
Data mining. So you have a big data. You take only diabetic. In that diabetic, only this age. And in that age, what are the complications? Then we can compartmentalize.
So you're looking at prediction.
Data mining at a larger scale.
But eventually you'll be predicting either a complication or the prediction whether this person is liable to get diabetes or will liable to get into renal failure or whatever. So you're looking at prediction. Anything else? Guys, come on. You're running hospitals. Hi, Neeraj.
Hi.
You guys are running hospitals. Is that your primary concern?
Antibiotics.
Antibiotic resistance. Okay, what else?
Can it make me more money?
Oh, thank you very much. Thank you so much. Today, when I look at healthcare, I talk to hospitals. I don't know why it is not coming up, probably because you're skewed into clinical, which is important. But if I talk to hospitals and I talk to doctors, a vast majority of them in India are seriously concerned about the business side. Nobody really is bothered about too much about clinical outcomes. All of you talk clinical. Believe me, maybe you're not, don't have that area of under your control, which is possible. But the fact is, if you talk to a doctor, so I was talking to a nursing home, I was talking to the president DMA, and he said, boss, हम 10 लोग हैं, हमारे नर्सिंग होम बिकवा दो यार, हमारे बस की नहीं चलाना नर्सिंग होम. We can't run our nursing homes. They have become unviable. I don't have the top line. The top line is coming down seriously. My revenue is coming down seriously. I don't know what to do. And I'm not able to manage costs so effectively. I have no idea how to do that. Compliance is a huge problem. There was a big problem in Delhi last week, which these guys said, because people came from some biomedical waste department, some DPCC pollution control guys, and they sealed a few nursing homes. Why? Because they were not maintaining registers. The guy said, I was not maintaining a register because I was maintaining it in a different format. And the guy said, no, you are supposed to maintain a register, that's it. So compliance has become a problem for me. I have a problem with cash flow. I have 5 crores which I need to get from Ayushman Bharat and CGHS and ESI and whatever it is, and my doctors are asking me for money because they have done their surgery. They are asking, can I get my payment? And my vendors are asking for money. I don't have cash. I'll get it after 6 months, 9 months. These are real everyday problems that doctors and hospitals are facing. This is in terms of non-clinical areas. So if I ask a doctor, honestly, the clinical component still feel that they are capable of handling. They still feel. Of course, they talk about the fact that yes, we would like to improve patient experience. Now it's no longer about clinical outcome so much as patient experience. Clinical outcome is part of that. Clinical outcome is part of that. But it is about patient experience. So people are now, if you look at industry, there was somebody who did a analysis on small nursing homes and small hospitals. They are in trouble, and I don't want to get into that because that's not the purpose. The other big area that we talk about when we talk to large corporate hospitals is that their margins are coming down from double digits to single digits. So that is a matter of great concern for them. They don't know what to do, right? So that is one area. So if you ask any doctor, if you ask them in a 1:1, maybe because it's a forum, most of you are not talking about it. But the fact is, these are the areas that concern them today. Revenue. Number 2, compliance. Number 3, margins. Number 4, dissatisfied patients. So medication error is important, sir. But honestly, when I was CEO, medication error is a very small component when I look at it. Of course, if you're handling that area as a quality manager, or if you are handling that as the clinical pharmacologist, is someone sitting here, then that would be probably a big priority for you. But if you look at it from a 50,000 feet view, or from the objective from the healthcare perspective, these are the problems that all of us are facing today. Now, these problems are not just India's problems. American patients and industry is probably in deeper trouble. Is in deeper trouble. And unfortunately, we are aping the American model, which is going to be a serious disaster for us. But that's not the purpose of this. But I wanted to understand from you, these are your concerns. And can AI help me? This is what my concern is. So most of us talked about this concern, right? But there are these concerns also.